The pilot program targets to reach Kenyans living in the high prevalence regions to test the vaccine's effectiveness. The program, funded by the World Health Organization and the Ministry of Health, is an added strategy to curb the mortality rate in the country.
The malaria vaccine, the RTSS, has received a positive scientific opinion from the European Medicine Agency, the EMA, and a policy recommendation by the WHO.
As the country commemorates the annual World Malaria Day on Monday in Kwale, the government has lauded efforts in embracing various strategies deployed, in which it has recorded an 8% drop in a span of 5 years. The Director of Medical Services, Dr. Jackson Kioko, representing the Health Cabinet Secretary, says 12.6 million insecticide-treated nets were issued to 4.2 million households last year, resulting in reduced cases of malaria at 12%.
I wish to appeal all those who have received the nets, and especially in the endemic and highland epidemic prone areas, to use these nets for purposes that they were intended for.
In a continued fight against the disease, Kioko says that the ministry will be relaunching the in-house spray intervention program that has proved to be effective in the campaign. He also urged the NGOs and the private sector to continue supporting this campaign. His sentiments were echoed by Sanchin Verma, who was speaking on behalf of the private sector involved in the campaign.
The proportion of people protected by at least one malaria control method has increased significantly. But there's still work to be done, and total funding will only match the needs if we as international donors and corporate partners and national governments prioritize further investments in malaria control.
We can accelerate our efforts of achieving these goals if we continue to prioritize the welfare of women and children, who too often pay the greatest price when malaria hits home.
For Channel 1 News Hour, I'm Junika.